I guess we could start.
Good. Okay. I'll just go through the questions then. I'm happy to answer any questions as they arise. This is the, we're going to focus on asthma since this Facebook group is for asthma. So I understand the questions are not on food allergies, but this is all with respect to the End of Food Allergy book that we just wrote with our wonderful publishers, Random House. And so we're really excited that a lot of these questions are also spoken about in the book. So we hope that people find them helpful, and I'll try to answer questions today in real time. But in addition, the book does have a lot of items, hopefully, that you find helpful about asthma too. So the first question is, if I wear a CPAP nasal piece at night, would getting a HEPA air filter be a beneficial addition? I think everyone is wondering about HEPA filters in the time of COVID. In general, if you have the resources to be able to buy a HEPA filter, please go ahead, especially if you have to work in an environment where you're with and exposed to other people. HEPA filters would be excellent to have, because they do cut down the frequency that the virus is circulated in the air. So if you can get a HEPA filter, that's great. But if you can't, it's okay to have a CPAP machine alone. And that's just helpful to keep your airways open. It's not a CPAP machine itself is not helpful against COVID, for example. So I'm glad your pulmonologist, whoever asked that question, I'm glad your pulmonologist is recommending that you purchase one for the bedroom. If you happen to live in California or in the West, where there's a lot of wildfires, especially this season, unfortunately, the HEPA filter will also help cut down on particulates in the air that could worsen asthma. So in general, it's just better to have a filter and a mask on. If there are wildfires, it's better to have an N95 mask on. The next question is, does Xolair really help? So we talk about this in the book. Xolair helps with asthma. It's approved for the FDA for the use in asthma. It's also approved in Europe and other countries. It's used even as low as 6 years of age. So for certain patients, they have felt that Xolair really helps their asthma. For other people, they try it and they don't get as much help as, let's say, other people have, but that's where in all medicines, that's the case. Sometimes you get a lot of help from something, sometimes you don't, but at least to try it is good. It's overall a very safe medication. So if you do want to talk to your doctor about it, there are certain ways to make sure that you're eligible for it and that your insurance company will pay for it. So that's good. Xolair also has been used in food allergy, and we talk about that in the book, to be able to help with food allergy therapy and with food allergy reactions. It's not perfect yet. Well, I think one of the things we talk about in the book, just like any therapy for asthma or food allergies, we need to get to personalized medicine better. We base everything we do on science, on clinical trials, on rigorous data that we can depend on. And each person's different. And I see patients a lot in clinic, and they have different types of asthma or different types of food allergy, and they're different ages or they're different groups. And I think we should make sure that each therapy caters to each individual. And I think we're getting there. So that's where making sure that we are advocates and help each other out in, if we are going to take an asthma med, make sure we know how to use it and when to use it, and connect with a doctor to make sure that it's helping us. The next question is, how close are we to gene therapy or anything else to improving FEV1? Great question. So for those of you who might not know what FEV1 is a forced expiratory volume within 1 second. It's used typically to be able to understand how bad someone's asthma might be. And asthma is associated a lot with airways that are closed down and that are very tight, so that when that air rushes through a tight airway, you can hear wheezing. And oftentimes that's associated with asthma, although not always. Sometimes asthma can be associated with cough only. And with all of this, we measure this thing called FEV1 from a tool machine called a spirometer, and we do that in clinic. And for those of you who have bad asthma, you'll remember that, and you breathe into a tube and it helps you know what your forced expiratory volume at 1 second is. And it's a good way to track asthma. So this question is about gene therapy. And for as much as we know that asthma is caused by one gene, yes, it would be possible to do gene therapy down the line. And there's a lot of ethics involved in that and a lot of other things that we don't have time on this call to, or this Zoom conference to talk about. We talk about gene therapy in the book itself. But importantly is that asthma is not associated typically with one gene. It's what we call a syndrome. Asthma incorporates a lot of different things. People can get asthma from having allergies to dogs. People can get asthma from having allergies to food. People can have asthma from getting a viral illness. People can have asthma from smelling perfume. People can have asthma and they don't understand what causes it. People can have asthma and it's due to exercise. So we need to understand more about what are the causes of asthma. And when we do understand the causes of asthma, then we can get better therapies. However, we do know a lot about the allergic causes of asthma, for example, and that's why Xolair and another drug called dupilumab really help. And steroid inhalers help a lot with calming asthma down. So over the past number of centuries, people have had asthma. And so there are medicines that your doctor prescribes that really do help in decreasing asthma. But gene therapy is one of many things that should be tried in the future. But we need to understand each person's different asthma, and then we can get personalized therapy for that person's asthma. I hope that was helpful. The next question is, does asthma change in severity as we age? Great question. So typically, when someone is a child, you can't really have a diagnosis of asthma before you're 5 years old, because you have to use that machine that I was talking about called a spirometer to be able to definitively diagnose asthma. And so before the age of 5, it's called wheezing or reactive airways disease. After the age of 5, you can do a spirometer, and then you know if you have asthma or not. Once you have asthma as a child, you can grow out of it. For example, boys grow out of asthma way more frequently than girls. Girls tend to get asthma after puberty. And that's not to say everyone falls within this category, but it's just what we typically see. There's some places in the country where 1 out of 5 people have asthma. There's other places in the country where 1 out of 8 people have asthma, but it's about 1 out of 8 in the world. Pollution makes asthma much worse. So as you age and as you get exposed to more and more pollution, more and more chemicals, more and more wildfires, it is possible that your asthma could get more severe over time if you don't take the right medicines. And sometimes if you do take the right medicines, it could still get more severe. And that's why you have to really take care of yourself and make sure you don't get exposed to bad chemicals or bad pollution or wildfires that could make your asthma worse, because most asthmatics, those types of particles are not good to have in your lungs. So there are some people, though, that grow out of their asthma. I have seen people that if they can exercise, if they can take good care of their diet, if they can take good care of their sleep, I know that's easier to say than to do, but if you can make sure that you have a healthy diet, a healthy living style, that does tend to be associated with people that can have their asthma get better over time, as well as really make sure you use your medicines in the right framework that your doctor told you to use them in. The next question is, can asthma triggers for an asthma attack change? Like some smells weren't a problem before, and now they are a problem. Absolutely. So oftentimes when someone has asthma, some of the prototypical medications that you use are like asthma inhalers, or and those asthma inhalers can be albuterol or can be steroids. For people with moderate or severe asthma, you need both. For people that have mild asthma, you just need your albuterol steroids. People also have tried other medications that are oral medications. If you have allergies, it's good to use antihistamines. But the question here is, what are the asthma triggers? And if someone does have asthma, they can have different triggers at different points in their life. I have patients where they were fine, they never had asthma, and then by around 40 or 50 years old, they went into a place that had a lot of different chemical smells in it, and then all of a sudden they became sensitive to that smell. And then after that, for the next 2 years, every time they would smell that, they would have an asthma attack. So that is common. Just because you're triggered by one thing in the very beginning doesn't mean that's the same that's going to happen for the rest of your asthma. So you really have to be careful and know your triggers, but that those triggers can change over time. But typically, if you're allergic and that's a trigger, like dogs or cats, then the most important thing is to talk to an allergist and try to get desensitized to dogs or cats, because that'll help you prevent your asthma from being worse. The next question is, how does asthma relate to allergies? It relates very frequently. So I call it one united airway, because your nose talks to your lungs and your lungs talk to your nose. And so with allergies, oftentimes it's environmental, with dogs and cats and insects and pollens and oak, and I'm sure people can name many more. But if you breathe those in, they first go into your mouth and your nose, and you have allergy cells right there. And the way that our body sort of misfires in allergy is it produces a lot of mucus to get rid of that pollen, to say, that's not normal. I see you as an enemy. And unfortunately for people with allergies, they secrete a lot of mucus. And so that mucus can run down your nose, run down your throat, run down into your airway. And your lungs don't like mucus either. So when they see that mucus, the lungs start to spasm, and that's what causes a lot of the wheezing. So allergies and asthma are very connected. There are some lucky people where they have allergic rhinitis, they have allergies in their upper airway, but it never goes into their lower airway, their lungs. So that's good, but you never know. So when someone has bad allergic rhinitis, sneezing, mucus congestion in their nose, I always ask them about asthma because they oftentimes go together. So I'll stop there. Those were the main questions that were submitted before the talk today. I have about 5 minutes before I have to go back to the clinic. But if people would like to ask me any questions, I'm happy to answer them. We can either do that via the chat okay, I see more questions in the chat, so let me answer those. Do you know if asthma can cause tingles and shakiness throughout the whole body, or if that is caused by anxiety? Those types of symptoms, tingles and shakiness, are typically caused by the anxiety due to asthma, and I understand. I had asthma when I grew up. It is very anxiety producing. I totally get it. Situational anxiety is very strong with asthma because you feel like you can't get enough air to breathe, and that is scary. And so the tingles and the shakiness can also be a response to your albuterol inhaler, though. So if you're taking albuterol inhaler, sometimes that level of, pretty much it's like the equivalent of caffeine, that can make you very shaky and get tingles. So I just want to make sure people know that. Can going on birth control help prevent or reduce asthma flare-ups that occur around the menstrual cycle? Typically, yes, because birth control pills allow your hormones to be a little bit more stable and not so much in terms of up and down. So I have had patients say that their birth control pills help them with their hormonal cycles, so it is possible. And then quaternary ammonium compounds are my biggest concern, since I have read many times that they trigger asthma symptoms and can even cause new onset asthma. Yeah, I know that based on disinfectants used in your schools, do you think safer options such as hydrogen peroxide? Yes. So there are many toxicants in some of these cleaning fluids. And I know COVID, it's a time of COVID, so we want to keep clean, but basically 70% alcohol or better will kill COVID, and you can use it on hand sanitizers or use it on surfaces. But anything more than that, you don't really have to use worsening chemicals. So ammonium compounds, I would try to avoid. It's not good for your lungs. Hydrogen peroxide doesn't necessarily get in the air, but I would also try to avoid hydrogen peroxide too. Use disinfectants with 70% or more alcohol, because that alcohol vaporizes so quickly it doesn't get into the lungs in a toxic way typically. And importantly, that's what kills COVID and kills other viruses too. So I hope that's helpful in terms of what to use. I hope that schools will use more disinfectants that include 70% or more alcohol rather than other items, because it's just safer in general. I think those were most of the questions. If there's anyone else that wants to put a question on the chat, feel free to, but I'll sign off if unless there's other questions. I really appreciate everyone coming today. I know people are busy. I hope this was helpful. We're doing a lot of research now in asthma and COVID, and trying to understand more how we can best help patients with asthma who get COVID or who want to be protected against COVID. And I hope that you'll all buy the book. It's really exciting to know that food allergies and asthma and allergies are all connected. So some of the very same things that can help food allergy can also help asthma too.
I think that's all the questions we have. So
great, thanks, Tatiana,
for speaking with us today.
Well, thank you, everyone, and I hope you have a good day.
You as well. Thank you.
Bye. Bye.